As a nurse, I have seen how endometriosis can go undiagnosed for years. Today, I'll explain it in simple terms. I'll explain signs and symptoms, diagnosis, and treatment. Hello and welcome back today to today's health session. I'm Mary Stacia Mruka, or you can call me Stacia Mruka. And in this video, we are going to explore a condition that affects millions of women worldwide, but it is often misunderstood. I'll break it down, what it is, its causes, common symptoms, and how it is diagnosed, and the treatment options that are available. Whether you are a healthcare provider, whether you are a student nurse, whether you are someone who is affected with this condition, that is endometriosis, this video will provide clear, reliable information to help you understand endometriosis better. So let's dive in and shed light on this often painful and overlooked condition. So endometriosis, what is endometriosis? Endometriosis is a chronic condition. Chronic means this is a condition that you are living with or that you will live with. And most chronic conditions are untreatable. Most of them are untreatable. So this endometriosis, which is chronic, often is a medical condition where tissues of similar to the uterus, to the uterine wall, grows outside the uterus. Despite being outside the womb, this tissue behaves like endometrium. It thickens, it breaks down and bleeds during menstrual cycle. But it has no way to exist in the body, leading to inflammation and scarring. And that is what usually brings the pain during menstruation. Most people who are living with endometriosis, they have problem with getting pregnant. So we are going to also to see if this condition, if you have this condition, are you capable of getting pregnant? Are you capable of conceiving? Are you capable of living a normal life? So what are the common locations where this endometriosis or where the endometrial plants to the common location of endometrial implants? So it can implant itself in the ovary, in the fallopian tube, outside the surface of the uterus, the peritoneum, the intestine, the rectum, the bladder, the uterus, and in rare cases it can goes even to the lungs and into the brain. So let us look at the causes. The exact cause is unknown. Most of these conditions which are chronic, their causes mostly remain unknown. So as just the same way as any other chronic condition, the exact cause is unknown, but there are several theories that exist. So number one, retrograde menstruation. What do I mean by retrograde menstruation? Menstrual blood flow backward through the fallopian tube into the pelvic cavity. Number two, metaplasia. Cells lining the abdominal cavity change into endometrial-like cells. And number four, immune system disorder. Impaired immune response fail to eliminate misplaced endometrial tissues. Number five, genetic. It tends to run through the family. And number five, or number six, I don't know, is lymphatic or vascular spread, to mean endometrial cells spread via the lymphatic or the blood vessels. Those are some of the several theories that exist about the cause or the etiology of endometriosis. Who is at risk of getting endometriosis? Anybody, any woman is at risk of getting endometriosis, and this group of people which I'm going to list are at higher risk of getting endometriosis. Number one, family history. If endometriosis ran in your family or someone has ever had this condition, it might affect you. Also, starting period so early. Another one, short menstrual cycle of less than 27 days. Another one, heavy bleeding or prolonged period, more than 7 days. And number six, low BMI. And number seven, never having given birth. Those who are child-free by choice, this condition might affect you. Yeah, this condition might affect you. Now let us look at the signs and symptoms of endometriosis. Number one, pelvic pain, pain during intercourse, pain during bowel movement and urination, heavy menstrual bleeding or spotting in between periods, infertility, which should be discussed. Infertility is a huge topic. Also fatigue, diarrhea, constipation, bloating, nausea and vomiting. How do you diagnose? How do you find out that someone is having endometriosis? Pelvic exam is one of them. Ultrasound can detect the cyst associated with endometriosis. MRI and also laparoscopy. What are the stages of endometriosis? Endometriosis can be classified by the American Society for Reproductive Medicine into 4 stages, where we have the stage 1, which is minimal, the stage 2, which is mild, the stage 3, which is moderate, the stage 4, which is severe. So based on the location, the extent and the depth of implant, the presence of the adhesion and the ovarian involvement, that is how we will stage this endometriosis. What are the treatment options available? Treatment depends on the severity and the woman's goal. Some people say they don't want babies, so if it affects the uterus or any organ in the uterus can be removed. But some say that they might want to get pregnant in future, so you will just deal with given painkillers or pain relievers, hormonal therapy to suppress the menstrual cycle and the endometrial growth. It can be combined oral contraceptives, progesterone, among any other hormonal treatment. Surgical treatment, I've said a woman can decide. In severe cases also, even if you did not decide, or the doctor can help you decide which treatment is best for you. Complication that you might get when you have endometriosis: infertility. 30 to 50% of women who have endometriosis, they suffer from infertility. Ovarian cyst, chronic pelvic pain, bowel dysfunctions, emotional stress, anxiety, and depression most of the time. How can it be prevented? There is no way to prevent endometriosis, but early diagnosis can reduce the complication. Exercise, anti-inflammatory diet, stress management may help control the symptoms. Avoiding estrogen heavy medication unless needed also is very important when you are a woman. So those are the things that I wanted to say about endometriosis. So if you like this video, you can subscribe. Also, make sure you share the content. Comment in the comment section which condition do you want me to talk about next, so that I'll prepare about that condition, or I talk about it. Let's get into the next video. Bye. Let's meet in the next video. Let's meet in the next video. Bye.